My name is Amanda Waltemath, and I am a clinical pharmacist with Healthesystems. I've been with Healthy for about 7.5 years now, and currently I oversee our clinical account support group, so our client-facing pharmacists. Years and years ago, I participated in a medical mission trip to Honduras. It was way back in high school, I think, and I knew I wanted to go into healthcare. And as part of that medical mission trip, we visited a children's hospital in Tegucigalpa on our last day there. And so we went to drop off some of our leftover supplies and visit some of the patients there. And the children were really malnourished. They were very, very ill, and they slept on bare mattresses with no blankets or pillows or anything. But what struck me the most from that trip was that in place of an IV, they had a syringe stuck into their arm with a piece of cardboard and duct tape. And that sight haunted me for years. And I think what really drove me to become a pharmacist was I really wanted to promote accessibility and opportunity for everyone who needs medicine. I think what has made me stay a pharmacist has been really seeing that the small things that we do that impact patients' lives ultimately do add up to real change. I probably would have followed in my grandfather's footsteps in becoming a doctor, either that or a children's book author, actually. So that is still a goal that I have, is to write a children's book. I was out of pharmacy school and started as a resident. So I actually rotated through Healthesystems as a fourth-year pharmacist. So we still, to this day, take pharmacists in their fourth year of school. We let them come in and do a rotation so they get exposure and opportunity to see what it's like in managed care. They don't really get that as part of their curriculum. So I did a rotation with Healthesystems. I decided that this is where I wanted to work. And so I contacted my preceptor at the time and essentially talked the staff here into bringing me on as a resident. So 7.5 years, here I am. It was the people and the culture. It was the passion for patient care. It was seeing the ideas that we bring and what we're able to implement actually turn into, actual patient care programs and clinical interventions with prescribers, and seeing that make a difference. From a pharmacist perspective in a PBM, we have a lot of tools that we're able to leverage. So our patient care continuum really spans, from being able to define and configure formularies that are very customized for a patient population. We have the ability to develop and build clinical intervention programs for both patients and prescribers. We have the ability to educate not just our nurse case managers, our claims adjusters, but also prescribers out in the field. So one of the other things that we're able to do at Healthesystems is provide, direct education and dialogue to claims adjusters or nurses or prescribers who call our drug information line specifically to talk to a pharmacist about a patient's medications. So we're able to do all of that, and there's so many things that we do to impact patient care. My hope is for pharmacists to continue to be integrated into healthcare teams. So for pharmacists to eventually be seen as a true healthcare practitioner or provider, provide more cost-effective care, and provide more accessibility with, as a healthcare provider, particularly in rural settings or via telepharmacy, and really improve patient satisfaction. So that's where I'd like to see pharmacy go. I take what I do at Healthesystems very seriously, and I relate to it on a personal level. So, chronic opioid use and addiction and abuse is an issue that I continue to be really passionate about, because I have, on a personal level, seen really the impact and the suffering of chronic pain and opioid use from, someone a person, a family member, a friend who gets that first prescription for a pain medication and really is hopeful that it's going to heal them or that it's going to cure them or it's going to help treat them, and only to have that result in addiction and abuse and dependence. I mean, our patients are people, and so I really think that we owe it to them to continue to search for different avenues of treatment that will benefit them and not harm them. And I think that our customers are relying on us to do that as well. After moving into this new office, so I have my bulletin board with quotes all over it now. So I used to have very important phone numbers and stuff, and I scrapped that and I put quotes all over my board to inspire me every day. So I have there's a couple that are really meaningful to me. So one is, I don't know the origin of it, but the quote is, "How you do anything is how you do everything." And so I think that that's not just true for life and parenting and friendship and relationships, but but work as well. And the other one is one that I hold very close to my heart, and that is, "It is our choices that show what we truly are, far more than our abilities." And that is courtesy of a very smart man called Albus Dumbledore. So.